Dr. Lisa Broyles here with Way to Health MD. So I just got back from my favorite conference of the year, Synergy, put on by the North Carolina Integrative Medical Society. Such an amazing conference. And there was some really important topics that I wanted to share with you because they affect your health and they've really changed the way I practice after listening to these lectures. So we were fortunate enough to have Dr. Andrew Campbell, MD. He is an international expert and authority on mold toxicity and mycotoxins. You know, it really was so refreshing to see a fellow MD who is passionately explaining how mycotoxins are causing all kinds of diseases, much more than just a stuffy nose or allergies. Okay, this is for real. So Dr. Campbell went into a recent statement by the National Institute of Health in 2025, where they recognized that mycotoxin and mold exposure can cause cancer, cognitive decline, and other neurodegenerative disorders such as Parkinson's, multiple sclerosis, even fog and dementia. We're thinking even kids with ADHD, maybe fetal exposure and young childhood exposure. So he really opened my mind to the neurocognitive effects of mycotoxins. I really think this was something that I was missing, that a lot of us have been missing, because mold is everywhere, right? And it's kind of this thing that we don't want to touch, because if we tell a patient that they've got mold toxicity, it opens this huge can of worms because it's expensive to get your home remediated. I know, because I've done it once and now I've got more work to do after you saw that video where Rick Bayless came to my house. Dr. Campbell was explaining that you actually get what's called white matter disease, or white matter cell death. White matter is kind of the support structure in the brain. You get demyelination, you have dysregulation of your mitochondria, actual neuronal cell death in exposure to mycotoxins, which are released by molds, okay? This can be bacteria, fungus. Basically, he explained that the immune system gets dysregulated. You have something called T2-induced toxicity with increased reactive oxygen species. Okay, you're seeing people develop more autoimmune disease, again, due to mycotoxin exposure. So there's lots of them: gliotoxin, aflatoxin, trichothrones, ochratoxin A. I test for them all. I also learned something when it comes to testing from Dr. Campbell. So I've been testing just urine. He's saying that ochratoxin A does not bind well in urine. So if you're seeing it in the urine, there's actually a whole lot more in the body than there was on a urine sample. He said the most accurate way to test for mold is through serum IgGs, serum IgEs, so basically blood. So I now have an account with a new lab that I can do blood testing for mycotoxins, and I'll be doing that from here on out. He basically said treatment involves using antifungal prescriptions, which I can do, 8 supplements, which I can discuss with you if you have a visit with me, a low histamine anti-inflammatory diet, and last but not least, you have to remove the exposure. So you have to test your home. I recommend the ERMI, E-R-M-I. Go to Envirobiomics to get your ERMI test. It's the EPA's gold standard for mold testing in your home. I also recommend calling up A Healthier Home with Rick Bayless. Watch my video where he came to my home. Also recommend calling. He is the expert in diagnosing, finding the problem, and then he will point you to who you need to remediate your home. This is serious. Take mold serious. Please come ask me about it. Speak to someone like Rick Bayless with A Healthier Home, who's an expert in finding it, and then we can guide you in treatment. Thank you.